Welcome to this lecture. Today we have discussion on spinal cord. Spinal cord is a part of central nervous system. It is a long pipe-like structure arising from the medulla oblongata. It's a part of brain consisting of a collection of nerve fibers running through the vertebral column of the backbone. Anatomy of spinal cord. In adults, the spinal cord is usually 40 cm long and 2 cm wide. It forms a vital link between brain and body. The spinal cord is divided into five parts: cervical region, it's a neck region; thoracic, it's a chest region; lumbar and sacral is low back region; and coxal is tailbone region. Cervical, several spinal nerves merge out of each segment of the spinal cord. There are 8 pairs of cervical, 5 lumbar, 12 thoracic, 5 sacral, 1 coaxial pair of spinal nerve. Actually, understanding of physiology of the spinal cord help in detecting and determining the various method to deal with disease and damage related to the spinal cord. We have 31 pairs of spinal nerves. Injuries of spinal cord. Damage to any part of spinal cord or spinal nerve result in the permanent or lifelong damage to the spinal cord, affecting the normal functioning of the spinal cord without any replacement. Spinal cord injury not only has impact on the spinal nerves and vertebral column but affect the other muscles and vital organs as well. Functions of a spinal cord. Important functions of a spinal cord are mentioned below. It forms a connecting link between brain and peripheral nervous system. It provides structural support and build a body posture, facilitates flexibility, movements. Myelin present on the white matter act as a electrical insulation, communicates messages from the brain to the different parts of body, coordinate reflexes, receive sensory information from the receptor and approaches towards the brain for processing. We have completed with the spinal cord. Thanks for listening.